Hello. Wonderful to see everyone today. Hello. I'm Kim Meredith, CEO at the San Francisco General Hospital Foundation, and I'm delighted to welcome all of you and host the San Francisco General Hospital Foundation and Zuckerberg San Francisco General Hospital's COVID-19 briefing today. Our foundation's mission is to support ZSFG with essential funding for health equity, access, and quality healthcare for all, built on the pillars of innovation and new models of care. ZSFG serves all San Franciscans and is focused on its most vulnerable citizens, with the vast majority of the patients on Medicaid, Medicare, or uninsured. ZSFG is the Bay Area COVID Authority and has cared for up to 30% of the COVID patients in San Francisco. And it's because of all of you on this call that we can actually provide the vital support to ZSFG all the time, during good times and bad times and challenging times, such as during this pandemic. Thank you, thank you, thank you. So the format today will be a 25-minute conversation with Dr. Susan Ehrrich, and then I'll open it up for questions from the audience. Looking ahead, please submit your questions into the Q&A, and then we'll aim to group those questions into themes so that we try and capture as many different directions and questions that you might have, and we'll get to as many as time permits. So today we are honored to have Dr. Susan Ehrrich join us as our featured expert. Dr. Ehrrich is the Chief Executive Officer of the Priscilla Chan and Mark Zuckerberg San Francisco General Hospital and Trauma Center. She is a professor of medicine at the University of California, San Francisco, and she is still a primary care provider and physician at the Richard Fine People's Clinic. So with that, please join me in welcoming Dr. Ehrrich. So thank you for joining us today. And since we last gathered for a COVID update some time ago, a lot has transpired at ZSFG and in San Francisco to combat the pandemic. So Dr. Ehrrich, maybe you can describe some of the advancements that ZSFG has made to actually manage COVID and to keep San Francisco healthy, certainly much healthier as a city compared to most other urban areas.
Yes, hello, Kim. It's really great to be here today, and it's great to be here with so many of our supporters. I'm really grateful to be here at ZSFG, to be a member of this community and in the city, and really delighted to share information about the pandemic and hear what questions folks have about what's happening here. So it's true that a lot has changed since the very beginning of the pandemic. But one thing that hasn't really changed is that we have always focused our attention on science, data, and facts from the very beginning. And it's because of those things that we've been learning throughout this entire time, and have been constantly changing and adjusting what we're doing, and taking advantage of our focus on science, data, and facts to address every moment during this pandemic. I think, you know, one of the things that's so different about now than was when we talked last is that vaccinations are widely available in the community. And just like everything else that we've done here in San Francisco, that has been based on science, data, and facts. And we've done a remarkable job vaccinating the community. I know we have some slides with some numbers on them that would probably be, you know, a good place to show those numbers. But one really important thing and milestone that we've reached recently is that we have fully vaccinated 80% of the eligible population here in San Francisco. That is a remarkable accomplishment. And I'm really proud that oh yes, here's the data. So of all the people eligible, meaning folks 12 and above, 80% of those folks have completed vaccination. I think the synonymous fact for the United States is more around 50%. So we've done a great job with that. And that is very important in terms of addressing the pandemic and where we are right now in terms of our multi-layered approach. So we have a vaccine, we have a lot of people vaccinated, and we know that's not enough in the current environment with Delta, which is so much more infectious than the variants we were dealing with earlier in the pandemic. So it requires us to be masked, requires us to be distant. It requires us to be, careful about how we gather with others. But we've done well, considering.
So it feels today, Dr. Ehrlich, that what's going on with COVID, it's really about the vaccinated versus the unvaccinated. So what can you tell us that might be a little different about this fourth surge as compared to the third surge when we think about all of these issues, and also maybe address some of the issues related to vaccine hesitancy? Well, we've done so well in San Francisco. There are other parts of the country where I'm sure some of our listeners have family and friends, and then we do still have some who we need to vaccinate. So we'd love to hear from you on all of that.
Right. So back in the wintertime, we were facing the worst part of the pandemic. There were many more cases, many more hospitalizations than we have right now. The other things, though, that were different were that we had only just started vaccinating people. We were dealing with a different variant. And for the most part, we were staying at home. Mm-hmm. And all those things are different now. So now we're vaccinated, but at the same time, we have a more infectious variant, and we are far more likely to be out and about with one another. So in some ways, if you think about it, the infectious variant and being out and about with one another sort of counteracts the protection of the vaccine. And so I think if you think about it in that way, it helps you understand kind of where we are with the Delta variant right now. At the end of June, the beginning of July, we thought, we're done with this pandemic. We can take up our masks. We can do whatever we want. But just as we started doing that, the Delta variant became predominant. And so that's why we have this fourth surge. So again, it is true still that that the vaccines are very helpful. Masking is very helpful. If you look at the statistics about infection rates, you are 2 or 3 more times more likely to become infected if you're unvaccinated. And if you get COVID, you're about 8 times more likely to be hospitalized if you are unvaccinated. So it's not to say that the vaccine and no vaccine is ever perfectly protective, but it is a really crucial and critical part of this multi-layered defense that we have against, in particular, the Delta variant.
So the foundation has been involved in supporting some work that you and the Department of Health have been engaged with related to vaccine hesitancy. So we still have 20% of the San Franciscan population that has not received one vaccination or any vaccination. What are you doing in that realm? How are we managing that? Can you give us a little bit of additional information about that vaccine hesitancy issue so that we can all be thinking about how we might be able to help you and the wonderful team over at ZSFG?
Sure. Well, if you go back to the beginning when we started vaccinating folks, and by the way, we administered the first vaccine to one of our healthcare providers in San Francisco here. That was a very special day, December 15th. And when we started vaccinating, it was like opening up a dam, and we had so much demand for vaccine, the demand far outweighed the supply. And so in that setting, we opened up, the city opened up more accurately, multiple mass vaccination sites. And this was a very unique San Francisco experience. It was done, these big sites at Moscone and City College and the market in the Bayview were all opened in conjunction with other healthcare providers in the community, and was a really great example of the partnership we have with them, and continue to have. But then as time went on, of course, those who really wanted vaccines, we got to all of them. And now we are at a place where we are really dealing with a situation where the people who aren't vaccinated are people who have deep hesitancies about getting the vaccine for one reason or another. So just like we've done with the rest of the pandemic, the department and the city have shifted their strategy from a strategy of no dose goes wasted to a strategy of no opportunity goes wasted. And basically what that entails is being hyper local in the vaccine strategy. And again, relying on data and science to drive that strategy. In this case, it means we know that there are certain areas of the city that have much higher rates of COVID still and lower rates of vaccination. Bayview Hunters Point has been #1 for quite some time. So what we're doing is working with the community to drive the strategy for how to reach those populations that are still hesitant to be vaccinated. And I will say, not everybody is hesitant for the same reason. We tend to lump people into the vaccine hesitant, but everybody has their own story, and a really fundamental part of how we reach people is by listening to what their concerns are. Because if we really listen, the strategy becomes a lot more clear about what information people need, who they need to hear it from, how it needs to be delivered. So, for example, there was a study done, among people who weren't vaccinated here in the city, and it showed that a lot of the reason people weren't vaccinated was because they didn't have time to go get a vaccine. They had to go to work. They had to take care of their kids. They didn't have a ride. That really changes your thinking about the strategy when you know things like that.
Great, thank you. Another question that's on our minds, I'm sure, is talking about breakthrough cases. Can you actually describe what is a breakthrough case so that everybody on the call here today has an understanding of that, and what they should do if in fact they do have a breakthrough case?
Right. So we talked about this a little bit, but a breakthrough case, I think, is what we think about when somebody who's fully vaccinated, meaning 2 weeks out from your second vaccine, if you were vaccinated with Pfizer or Moderna, or your one shot with J&J, and you get COVID. We know that that's possible, and we've seen that demonstrated. And we know that no vaccine is fully protective. So, for example, the flu vaccine that most of us get every year doesn't prevent every case of flu. But we know that the flu vaccine does hopefully minimize the symptoms you get if you are infected, and it protects you from death. Same thing with the COVID vaccine. You are 2 or 3 times more likely to be infected if you're not fully vaccinated, and you're 8 times more likely to be hospitalized if you get COVID and you're unvaccinated. So we shouldn't have expected that it was 100% protective, and especially with the Delta variant, which is more infectious, and all of us being out and about more normally than we were before during the most, the biggest surges of the pandemic, we're going to be, we're going to expect to have some infections among the fully vaccinated.
So how is Delta, and where do the breakthrough cases fit in terms of the patients that you currently have at ZSFG? Sort of what's the breakdown of all of that look like today, and how is that either stressing you or and the capacity of the system, or are we okay here in the city?
There's no question about it. Every healthcare organization, every healthcare system in the country is stressed because of COVID. There's no question about that. It was true in the beginning. It's even more true now that we're, more than a year and a half into the pandemic. I think the question is, what's the relative level of stress? And the big picture for San Francisco is, and the Bay Area really, is that because we took the approach that we did, that was driven by science and data and supported by the community, meaning that people were willing to stay home, people were willing to wear masks, that mitigated the full impact of the pandemic. So what it means now is, San Francisco General today, we have 25 people with COVID in the hospital. 8 of them are in the ICU. I think 14 of those people are unvaccinated. So the majority of them are unvaccinated. But if you were to go to Florida or Mississippi or Texas, hospitals are completely overwhelmed. They have a much higher percentage of the patients in the hospital sick with COVID. They have many more people out because their workers are sick with COVID. So if you look at it on a relative basis, I think because of the approach we've taken here in the Bay Area and in San Francisco for sure, healthcare systems are relatively spared. Not that we're completely spared by any means, but relatively so.
Okay. So vaccines, masks, sanitation continue to be sort of the best solutions, whether we're looking at the original COVID, Alpha, Delta, 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 and Lambda, if you will. So for those who are vaccinated, what are the best steps in preventing getting contracting COVID? And what about those who are unvaccinated and those who are ineligible, such as our under 12 and our children that are all going back to school? Can you tell us a little bit about that? I think that's very much on many people's minds.
Yes, of course. Well, so the key is, and I'm going to sound like a broken record, the key is if you're eligible, get vaccinated. That's a really important thing. And again, we're talking about this multi-layered strategy. So get vaccinated, and then in certain circumstances, you're going to be wearing a mask. So for example, if in San Francisco, you're required to wear a mask indoors in public. So that makes it relatively easy. But even if I'm outdoors, if I'm in a crowded setting with a lot of people, I am definitely going to wear a mask. So that's the basic strategy is get vaccinated, wear a mask, when you're inside in public, and be careful about the environments you choose to be in. It would be the same, for people who are ineligible, like kids going to school. We have a lot of safety requirements in place. So for example, the adults who are around them are going to be vaccinated, right? The kids are going to be wearing masks. They're going to be sanitizing. They're not going to overly crowd in spaces. The benefits of kids being back in school now, especially after having been out for a year and a half, I think, in the public health mind and in our minds should far outweigh the risks of them coming together. And that's what we're trying to support here in San Francisco.
And would you send your own children back to school?
My kids are happily in school today. 2 of them in person in school for the first time together at the same time in a very long time. They are old enough to be vaccinated, which I'm very grateful about. But they need to be in school.
Thank you. Thank you. I think when it gives everyone reassurance to know that you're letting your kids go back to school.
Yes.
Yeah. Okay. Thank you for that. Well, you've given us a lot to think about. So I'd really like to open it up for everybody here in the audience and see what questions we have coming our way. So let's see. I can see that we have a first question. How has having the new acute care hospital made a difference during this pandemic?
Oh my goodness. I can't even begin to describe, but I'll try. So first of all, thank you to the foundation for supporting this in the building in unprecedented ways. The city and county of San Francisco residents supported a almost $900 million bond issue in 2008 to build a new acute care tower, and the foundation raised almost $150 million to support that effort as well. So that's been incredible. But the acute care hospital is essential for many reasons. First of all, it greatly expanded the space we have to take care of patients, especially in the emergency department, in our perioperative areas, in our inpatient settings. And when you have space, you have the ability to sort patients, separate them from one another, and really be able to follow better infection control practices. The second thing we do with that space is that we have individual rooms and we have modern equipment. So for example, in the emergency department, we have 59 individual rooms where we can put patients. In our inpatient wards, virtually every room, with some exceptions, is a single room. So that means that you can isolate and keep people safe, not to mention give them a pleasant environment in which to heal. We have an ICU that is much larger than in our old building, with modern equipment that really allowed us to be flexible and care for people with COVID in ways we couldn't have done in this building, our older building. So there are so many ways. We literally could not have faced the pandemic without it. The other thing that I will mention is that in August of 2019, we went live on Epic. And most people don't think about electronic health records being a critical factor in facing down a pandemic. But I think I've mentioned, data, science, and facts, at least 20 times during this presentation. Well, if we didn't have Epic, we wouldn't have the facts. And having Epic and other hospitals in the community being on Epic allowed us to build a database that provides all of the data pretty much in the public data tracker that everybody here has access to. So that was a huge, important investment that was supported by the city and the foundation in order for us to really address the pandemic as we did.
Great, thank you. The next question will not surprise you, boosters. Tell us a little bit about, should we get one if we're eligible? How and who will become eligible? So any light you can shed on boosters.
Sure. Well, today at ZSFG and throughout the city, it's recommended for people who have certain types of immunocompromise and who were vaccinated with the mRNA vaccines at least 28 days previously to get a booster shot. This is a very well-defined and smallish group of people. So it's people who've had solid organ transplants, it's people who are undergoing chemotherapy, it's people with primary immune deficiency disorders, and people who are on immune therapies like large doses of steroids or treatment for rheumatoid arthritis. So it's a very defined group of people. And for those people, we're offering booster shots now. As far as the rest of us, there's been a lot in the news, of course, about 8 months after your second dose, we should all be getting booster shots. Well, that was an announcement made by the president and head of the CDC, but there is a process that needs to that this whole offering needs to go through. And the first step is that the Committee on Immunization Practices needs to meet and review the data. That was supposed to happen earlier this week. It did not happen. The meeting has been postponed. They really need time to consider the data. I'm not sure what ACIP will say about that. We are expecting that we would be offering booster doses sometime in September or October, following along ACIP recommendations and then federal, state, and local guidance. We wouldn't do it without that. I think, it doesn't take a lot of thinking to see that offering booster shots to all of the thousands of people who are fully vaccinated is a massive operational effort, and more than likely wouldn't be done in the same way that we did it at the outset by opening up mass vaccination sites and so on. So the city and in conjunction with healthcare providers in the community is actively thinking about how we would do this once we have the direction and guidance to do so.
Do you think there's any possibility of this year's flu shot and a booster coming together in one vaccination, or do you see them still as get your flu shot and separately get your booster?
They wouldn't be the same vaccination, but it would make a lot of sense to offer them at the same time.
Great. All right. Thank you for that.
Sure.
The next question that's surfacing is about travel. Is it safe to go into airports, travel on planes? There's sort of been mixed messages around that. What do you advise?
Yeah, this is all a personal risk-benefit decision. And I know that sounds really squishy and is maybe frustrating to some, but the truth is that's really the way it is. So, for example, last week I traveled to Florida. Now you might look at me, Kim, and say, are you kidding? The COVID capital of the United States, I would never go there. And, I would normally, that's the way I would feel about it, but my mother happens to be there and I needed to go see her. So my risk benefit equation changed. Now, how did I take care of myself? Well, the FAA requires you to be masked when you're in an airport. And so you should do that. You might double mask. Airplanes are relatively safe places. You're wearing a mask. The air circulation is quite good. And then when you get to a place like Florida or anywhere else that doesn't treat the pandemic the same way we do here, you just have to be ready to be the only person wearing a mask. And so I double masked everywhere I was. I tried not to go into public places. I used the same strategy that I would use here. I was just much more cautious about it.
Well, since we're talking about Florida and some of the states where they have had less success with vaccinations, how do we combat this misinformation? That's another question that's surfacing. And how do we get out the facts?
Well, you might know that the Surgeon General of the United States called, misinformation about COVID a public health emergency. All I can say is that, we try to set a good example with our own behavior, right? We each of us individually makes an attempt to understand what the correct information is by, going to reliable sources. And then as a city, we've been very transparent about sharing data. We've been, very good about following, the science as we understand it in setting policy. Fortunately, we have a community that's interested in following those recommendations, so that helps a lot too.
So another question that has come up and certainly ties into information is, should we anticipate getting a booster for COVID every year the way we have been getting a flu shot? And is this now going to be, it kind of builds off what we talked about in the previous question, should we anticipate that that is what will happen as we move ahead and that truly the world has changed and our lives have changed?
Well, one of the things about, following science, data, and facts is recognizing when you don't have the science or the data or the facts to recommend any particular action. And I think this idea that, we might be getting booster shots every year, we might get booster shots every 5 years. I don't think anybody knows well enough. It's controversial now at this moment about the need for a first booster shot. And that's why, I think the ACIP is taking its time in reviewing the data.
Okay. Thank you for that. Another question that has surfaced: what happens if I get a breakthrough case? What should I do? How worried should I be? What are the symptoms that I should be looking out for?
Yeah. Well, anybody who's feeling ill now should be, getting a test and seeking care from their physician. I think it's, the same, a breakthrough case, COVID, whether it's breakthrough or not breakthrough, you'd want to treat it the same way. You'd want to be vigilant about symptoms. You'd want to be testing right away. You want to be, getting advice from your healthcare professional. And if you are infected, then you're either staying at home or you're seeking care at a hospital or clinic. And you're going to need to isolate and quarantine for 7 to 10 days so that you don't spread the disease to other people.
Right. Thank you. So with that, I'd like to ask you a final question, and it really has to do with looking to the future. We've heard a great deal today about the data science and facts that you have been using as a leader of Zuckerberg San Francisco General Hospital, working with our civic leadership and the medical leadership throughout our community. So as we look ahead, what gives you optimism or hope for the future as we continue our journey through this particularly challenging time?
Yeah, well, I have a lot of optimism. And the reason I do is because, we can really see that by following the strategy we have, that we can really beat back the pandemic. It's going to keep coming back at us. I think that seems pretty clear. Each time it comes back at us, it's probably going to be a different situation where we have an opportunity to learn more. But what I feel so proud about is that each time we've been faced with a new surge, with a new variant, we've been able to incorporate what we've learned in the past and then learn new things. And our team here has just been so incredibly outstanding, so resilient, so creative, so masterful in providing care to our patients and being a resource to the community. I just continue to be amazed by that and proud of it, and know that that's going to serve us over time.
Thank you. Thank you, Dr. Ehrlich. We are so incredibly fortunate to have your leadership at the helm of ZSFG and really serving as the spokesperson for public health broadly throughout San Francisco, but in particular to those who are most vulnerable. So thank you for joining us today. And I also want to thank all of you, our supporters, who support the funding for this life-saving and life-changing work. We really could not provide the important funding and support to Susan and her team without all of you. So gratitude to all of you. Thank you, Susan. And we wish all of you a safe and healthy evening and afternoon, and look ahead for the next month. Thank you.
Thank you, Kim, and thanks to all of you.